Welcome to the City of North Richland Hills online child care class. Child care workers must be trained on environmental health and food safety when working in a North Richland Hills child care facility. Child care workers are required to obtain this training within 30 days of hire. After reviewing this online training material, child care workers must pass an exam, then they will be issued a child care training certification. The training certificate must be kept on site at the child care worker's place of employment. The child care card is valid for 3 years in the City of North Richland Hills. This class will provide you with an understanding of child care laws and rules and provides an outline on what to expect during a consumer health inspection. This class covers facility and staff records and center requirements, environmental health and safety, communicable disease awareness and prevention, food safety requirements, pest control, and playground safety and facility maintenance. Texas Health and Human Services is the agency that licenses and regulates child care facilities throughout the state. The City of North Richland Hills is the local regulating authority that inspects child care centers. North Richland Hills has adopted the state codes along with some additional local requirements within the North Richland Hills Code of Ordinances, Chapter 18, Article 2. This is the ordinance that requires that all child care employees must be trained and obtain the child care worker card from the Department of Neighborhood Services. Richland Hills Consumer Health works to protect the public by ensuring that safe and sanitary conditions exist in local child care establishments. Consumer health responsibilities include inspecting, investigating, educating, and enforcing city ordinances. Consumer Health inspects child care facilities in North Richland Hills at least twice per year, and a separate food establishment inspection is also performed on the kitchen twice annually. If a pool is on site at the child care center, the pool is inspected monthly during the swimming season. Any complaints received by Consumer Health are also investigated as soon as possible, usually within 24 hours. Facility liability insurance in the amount of $300,000 for each occurrence of negligence is required in North Richland Hills. Centers must submit proof to the City of NRH in order to renew the annual permit and must also submit proof to licensing each year. Notify the parent of a child immediately if there is an allegation that the child has been abused, neglected, or exploited, as defined in Texas Family Code Section 261.001, while in your care. After the child is safe, you must notify the parent immediately after the child has an injury requiring medical treatment by healthcare professionals or the hospital, has an emergency anaphylaxis reaction requiring the use of an EpiPen, any situation occurs that places the child at risk while in your care, any situation occurs that renders the child care center unsafe, such as fire, flood, or other damage resulting from severe weather. Upon pickup, parents must be notified of minor cuts and scratches or bites from other children that required first aid by center staff. Within 48 hours, parents must be notified of communicable diseases or lice at the center, and within 5 days, centers must notify the parent of each child attending your child care center of a deficiency in the safe sleeping standards or the abuse, neglect, or exploitation standards. Several items must be posted at the center to be visible to center visitors and regulating authorities. These include your state-issued child care license, your NRH child care and food establishment permits, emergency and evacuation relocation plans in each room, required telephone numbers by or on each telephone, including NRH Consumer Health's number at 817-427-6650, the number for poison control, 1-800-222-1222, and the Texas Abuse and Neglect Hotline, 1-800-252-5400. You must also post your most recent state agency inspection report, the NRH Release of Children Procedures information, the licensing parent poster, and the Keeping Children Safe notice, a daily menu including snacks, a list of each child's food allergies that require an emergency plan, daily activity plans for each group of children, and any other notices as required by state or local code. This is an example of an NRH child care permit. The permit must be posted within public view. Once again, these are the required phone numbers that must be posted in a prominent place by or on each telephone in the child care center. If you use cellular phone service at your operation, you must ensure dialing 911 directs emergency personnel to the address or location of your operation. Child care center is required to have an emergency preparedness plan. An emergency preparedness plan is designed to ensure the safety of children during an emergency by addressing staff responsibility and facility readiness with respect to emergency evacuation, relocation, and sheltering or lockdown. This plan must include plans to relocate children to a designated safe area, the name and address of an alternate shelter, plans for how children will be accounted for during the emergency, and details on how communication will be maintained with parents and authorities. Staff members must be familiar with the plan details and practice the plan. Fire drills and severe weather drills are required as part of the emergency preparedness plan. A fire escape and severe weather plan must be posted in each room used by children in care. Fire drills must be completed monthly, and severe weather drills must be completed quarterly by everyone present in the center. One fire drill per year must be audited by the North Richland Hills Fire Department to ensure that the drill is done properly and safely. This audited fire drill can take place at the same time as the annual fire inspection. Life safety requirements include the annual fire inspection, annual fire extinguishing system inspection, a gas test every 2 years, if applicable, and the availability of a carbon monoxide detector or detectors on site. Staff members must have several records on site to comply with minimum standards. Dates of renewal are different for each record. NRH Consumer Health will always review the following: criminal background checks for each staff member, valid CPR and first aid training certificates, negative TB test results, the North Richland Hills Child Care Worker Card, and a valid Texas driver's license and valid transportation training for staff members that transport children. The director must assign someone as the person in charge of the child care center in their absence. When the director is not on premises and the child care center is in operation, a qualified caregiver must be assigned the responsibility of the person in charge. Designated individuals must know they are in charge and for how long. They must know their responsibilities while they're in charge, have access to all essential information to communicate with parents and state and local authorities as needed, and have the authority to direct the operation in compliance with minimum standards. All other employees must know who's in charge in the director's absence. The director must be on site at the child care facility 75% of the time or 30 hours per week, whichever is less. Employees, including persons not counted in the child caregiver ratio, must use good judgment, be respectful and patient with children, respect their cultures, and ensure that no child is abused, neglected, or exploited while in care. If abuse is suspected, it must be reported. Better safe than sorry. Caregivers must know and comply with the minimum standards. They must know the number of children, their names, and have access to the ages of children that are in their care. They must ensure children are not out of control. They must focus on teaching, care, and supervision of the children only. They can't complete administrative and clerical duties, meal prep, or janitorial duties while they're taking care of children. They must interact with children in a positive manner, foster independence and a cooperative atmosphere, appreciate children's efforts and accomplishments, and ensure continuity of care between caregivers and parents. Supervising children at all times means that an assigned caregiver is accountable for a child's care. Effective supervision reduces the risk of harm to children by preventing injuries and accidents. Supervision is about using strategies and techniques to promote care that creates a safe environment for children. Caregivers must have visual and auditory awareness and physical proximity to each child in their care. They must also intervene when necessary to ensure children's safety. Stated in the minimum standards, supervision of children is basic to the prevention of harm. The assigned caregiver is accountable for each child's care. Proper supervision includes responsibility for the ongoing activity of each child and knowing when to intervene when necessary to ensure the children's safety. Factors that must be considered when supervising include the ages of the children, individual abilities and differences, the facility layout both inside the center and outdoors on the playground, and any potential hazards or special circumstances. Supervision also includes compliance with required child-to-staff ratios as specified in the minimum standards at all times. Proper supervision includes maintaining the required child-to-caregiver ratios. This ratio is established by the minimum standards to determine the maximum number of children of a particular age range that one or more caregivers may be responsible for at a given time based on circumstances. Caregivers must always know the ages and numbers of children that they are responsible for at all times and be aware of the required ratio. As activities change, ratios may also change. Staff must be aware of those changes and differences in allowed ratios. For instance, when more than 13 children are in care, groups can be mixed for joint activities such as meal times, field trips, outdoor play, and nap times. A tracking system for children in care is part of proper supervision. It may be a paper sign-in and sign-out log, or it may be an automated system. If using an automated system, parents must have a unique identifier assigned to them, and caregivers must have access to the child tracking system. Safety is critical for child care centers that transport children. Vehicles that transport children must meet all criteria set by Texas Health and Human Services. Some items checked as part of vehicle safety include the center's name and contact information on the exterior of the vehicle, all seat belts are in good working condition, there's a fully stocked first aid kit, there's an approved fully charged fire extinguisher, there's a copy of the current vehicle liability insurance in the vehicle, all drivers have a current driver's license and valid transportation training, and the names of the children being transported and emergency care authorizations for those children are present in the vehicle. Before exiting the vehicle, child care staff must ensure that all children have exited the vehicle after being transported. Staff must never leave a child unattended in a vehicle. The North Richland Hills Child Care Ordinance has a specific requirement regarding the release of children in order to prevent the incident of a child being released to an unapproved individual. Each child care center must have on file a list of approved persons to pick up a child from care. In addition, each child must have a unique security code or number assigned to them. If an unlisted person is to pick a child up and is not on the list in the child's file, the following must occur. First, a parent or guardian must call the center and provide the name of the person picking up the child. The person picking up the child must also provide a photo ID to staff. The person picking up the child must provide the child's unique security code or number to staff members. And lastly, that person must sign the child out of care for the day. Environmental health and safety is the field that studies how substances or other environmental factors have an impact on human health. The presence of naturally occurring and man-made chemicals in the air, water, food, pesticides, cleaning products, furniture, and buildings or homes is relevant to early care and education settings. Almost half of young children in the United States spend their days in licensed child care facilities. Supervision alone cannot prevent all accidents and injuries. Therefore, the environment must be free of health and safety hazards to reduce risk to children. On the screen are some of the safety precautions that are required by the minimum standards. Additional examples of hazards to children include sharp scissors, plastic bags, knives, cigarettes, matches, lighters, flammable liquids, drugs and medications, sharp instruments such as an ice pick, power tools, cleaning supplies, chemicals, and other items labeled "Keep out of the reach of children." Children must be protected from individuals whose behavior or health status may pose a threat. No alcohol, controlled substances, tobacco, or vaping products, or individuals under the influence of these products are allowed at the child care facility while transporting children on the playground or during field trips. Precautions, like the ones listed on this slide, are critical for keeping the child care center clean and in good repair. Research supports preventive steps to help limit the spread of infections, such as regular and proper hand washing, ventilating rooms regularly with lots of fresh air, and establishing cleaning routines. Germs have difficulty growing in clean, dry, and well-ventilated environments. Contamination of toys and other objects in the room contributes to the transmission of diseases and germs in operations. Providing enough toys to rotate through the cleaning process allows children to stay in active play while maintaining a healthy environment. First aid kits are required in every child care center. First aid kits must be kept in a designated area that is out of reach of children but accessible to staff. The first aid kit must be kept clean, sanitary, labeled, and restocked as often as necessary in order to keep all required items available at all times. The items listed above are required in each first aid kit. Are allowed at the child care center as long as they do not create unsafe or unsanitary conditions. Parents must be notified in writing if pets will be kept on site, and current vaccinations are required for all pets handled by children in care. In addition, a health statement is required for each pet by a veterinarian. Some animals cannot be handled by children in care. These animals include reptiles, amphibians, and birds such as chickens and ducks due to the risk of salmonella. Sick or stray animals of any kind should never be handled, and dangerous animals are prohibited. After handling animals, children and caregivers must properly wash their hands. Talk some more about practices to keep and maintain a healthy child care facility. Health and safety includes elimination and reduction of germs within the child care center. As stated in the minimum standards, research supports preventative steps such as regular and proper hand washing, ventilating rooms regularly, and establishing cleaning routines that help to limit the spread of infections. Germs are a part of everyday life and are found in our air, soil, water, and in and on our bodies. Some germs are helpful while others are harmful. Many germs live in and on our bodies without causing harm, and some even help us to stay healthy. Only a small portion of germs are known to cause infection. 3 things are necessary for an infection to occur. The first is a source. These are places where infectious agents, i.e. germs, live. They can be sinks, surfaces, or on human skin. You must also have a susceptible person. A susceptible person is a person that is susceptible to germs entering their body. You must also have a means of transmission. This is a way germs are moved to the susceptible person. Germs are also spread by things such as coughing and sneezing, contact with infected people, and contact with contaminated surfaces, food, or water. Children must stay home if they're sick. If they exhibit fever, if illness prevents a child from participating in activities, or if they have symptoms that could be a severe or communicable illness, they must stay home from care. Some conditions require that children be excluded from care. You must follow the communicable disease exclusions required for schools, as defined by the Texas Department of State Health Services in 25 Texas Administrative Code 97.7, relating to diseases requiring exclusion from schools. Exclusion must continue until the readmission criteria for the conditions are met. Child care workers also cannot work when sick. This includes any symptoms of illness, including diarrhea, vomiting, jaundice, sore throat, or fever. Staff members must not assist with food preparation or service if they have sneezing, a constant cough, or a runny nose. Child care workers must not come to work if they show symptoms of communicable illness. The Texas Food Establishment rules require the exclusion of a food employee if the food employee is diagnosed with any of these big 6 reportable infectious agents, including norovirus, hepatitis A, Shigella, Shiga toxin-producing Escherichia coli, Salmonella typhi, non-typhoidal Salmonella, or COVID-19. Exclusion means the employee is not allowed in any part of the food establishment. Most child care facilities are also considered food establishments if they have a child care kitchen on site. Excluded employees must have permission from a doctor before they can return to work. An employee must notify his or her director if they're experiencing any of these symptoms or if they've been diagnosed with one of the big 6 reportable infectious agents. If a child becomes ill when in care, contact the parent to pick up the child. Separate the child and supervise the child separately from the other children, and focus on hand washing and sanitation, especially if the child has diarrhea or is vomiting. If an injury requires immediate medical attention, call 911, apply first aid and CPR, immediately contact the parents, and continue proper supervision of all other children in care. The World Health Organization defines a disease outbreak as the occurrence of cases of disease in excess of what would normally be expected in a defined community, geographical area, or season. When illnesses are suspected, provide the following information to the health department: number of children ill, number of child care workers ill, exactly what the symptoms are, the onset of illness, the duration of the illness, and any events that might have been linked to the illness, including meals, field trips, animal contact, and the dates that those events occurred. Your health inspector can provide information and guidance to help control further spread of the disease. A plan for communicating information about outbreaks must be established in the Emergency Preparedness Plan. Parents must be notified in writing within 48 hours of a lice infestation or any other kind of outbreak of communicable disease at the center. Talk about ways to control and prevent illness with proper hand washing. Proper and frequent hand washing is the most effective practice for preventing the spread of germs in a child care setting. Hand washing is the single most important means of preventing the spread of infection. The diagram above shows you some of the steps of proper hand washing, and we'll talk some more about these steps in the next slide. Research has shown that the single most effective practice that prevents the spread of germs in the child care setting is good hand washing by caregivers and children. Equipment needed for proper hand washing includes a hand sink with hot and cold running water, soap, and disposable towels. Hot water, as defined by NRH Code of Ordinances, is hot water that is between 100 and 120 degrees Fahrenheit. Follow these steps for proper hand washing. First, get your hands wet so that the soap will work. Second, apply soap and scrub for at least 20 seconds. 3, rinse your hands under clean water. 4, dry your hands completely with a paper towel. And 5, turn off the faucet using the paper towel so that you don't recontaminate your hands. Hand wash signs must also be posted at hand sinks and in restrooms. Let's talk about some of the times when you would need to wash your hands at the child care center. Wash your hands when you arrive at the child care center. before and after changing diapers, using the restroom, or assisting a child with going to the restroom, after handling bodily fluids, for example, after wiping noses, after applying bandages or cleaning up vomit, before putting on your gloves, after removing your gloves, after handling or feeding animals, after handling raw food items, and before starting food service, after eating, drinking, or smoking, after using cleaners or toxic chemicals, after participating in outdoor activities, before handling food or medicine, and after any other possible contamination. Standards require that the kids' hands must be washed before eating, before playing in a water table, after using the restroom, after a diaper change, after outdoor activities, after playing in sand, after feeding or touching animals, and any other time the child might have come into contact with a harmful substance or when their hands may have been contaminated. Best practice includes washing hands upon entry into the classroom or center. An infant that does not have proper muscle control of the infant's head and neck must not be raised to the sink to wash the infant's hands. Until the infant is old enough to be raised to the faucet and reach for the water, you must wash the infant's hands using an individual cloth or disposable towel with soap, followed by a cloth or disposable towel used to rinse with clean water and dry. Baby wipes may be used for infants that do not have the muscle control to hold up their head and reach for the water. However, the baby wipes must state that they are safe to use for infants, and they must be discontinued once the infant is able to be raised to the faucet and reach for the water. Ensure that you understand the proper hand washing steps so that you can prevent disease at your child care center. Remember that North Richland Hills requires 100-degree hot water for washing hands. Water must never exceed 120 degrees Fahrenheit to prevent burns and injuries. Research has shown that the single most effective practice that prevents the spread of germs in the child care setting is good hand washing by caregivers and children. Use of hand sanitizers should be used in moderation and should not be substituted for hand washing. Supervision of children is required to monitor effective use of hand sanitizers and to avoid potential ingestion or inadvertent contact with a child's eyes, mouth, or nose. Nothing replaces proper hand washing. Keeping the child care environment clean is one of the best ways to help ensure that children stay healthy. Dirty toys, bedding, linens, eating utensils, and surfaces can carry and spread germs. Regular disinfecting should be a part of the routine in a child care setting. Cleaning means removing dirt, food, and grease from a surface with soap or detergent and water. Properly clean all surfaces that come in contact with food to remove microorganisms. The difference between cleaning and sanitizing is that cleaning can remove dirt and most germs. Even though the surface looks clean, harmful microorganisms can remain after cleaning. Sanitizing means disinfecting the surface to kill the germs that are left on the surface, and it's much more effective than cleaning alone. Standards recently updated to contain a new definition for sanitize. The new definition is the use of a disinfecting product that provides instructions specific for sanitizing and is registered by the Environmental Protection Agency to substantially reduce germs on inanimate objects to levels considered safe by public health requirements. Many bleach and hydrogen peroxide products are EPA registered. Follow the product's labeling instructions for sanitizing or disinfecting depending on the surface, paying particular attention to any instructions regarding contact time and toxicity on surfaces likely to be mouthed by children, such as toys and crib rails. If you're using bleach instead of an approved disinfecting product, follow these steps. First, washing with water and soap. then rinsing with clear water, afterwards soaking in or spraying on a bleach solution for at least 2 minutes, and then rinsing with cool water only those items that children are likely to place in their mouths, and finally allowing the surface or item to air dry. Strips are used to check the strength of sanitizing solution to make sure the solution is not too weak or too strong. If the solution is too weak, it won't kill bacteria. If it's too strong, it could be toxic. This person is testing the concentration of quaternary ammonium sanitizer with a test strip. Quaternary ammonium is typically effective at 150 to 400 parts per million, but always check the label, and always follow the instructions on the container for using the test strip. The test strip is dipped into the sanitizing solution for a specified amount of time and then compared to the color chart that comes with the test strips. Holding the test strip in the solution for the required amount of time, the test strip is compared to a color chart. This color chart will be found on the test strip container. Sanitizing is a 4-step process, and all steps are required when there are no instructions listed for sanitizing on the label. Always use a test strip to make sure the chemical concentration is correct. And remember to follow the right recipes to mix sanitizer solutions, and to keep sanitizer solutions and all other chemicals out of the reach of children at all times. Some examples of routine disinfection of surfaces in child care environments that might help you prevent the spread of disease at your child care center. Here are a few examples of equipment and surfaces that must be cleaned and sanitized or disinfected after each use. They include diaper changing tables, countertops and food prep surfaces, toys, tables, thermometers, hand washing sinks, bathrooms and potty chairs, high chairs, trays, and tables used for eating, sleeping mats, and anything else that may be contaminated. Germs spread very easily in a diaper changing environment, so it's very important to follow rules about diaper changing in a child care setting. The first thing you should do is promptly remove soiled or wet clothing from the child. You should always use disposable gloves for diaper changing to avoid the spread of germs from your hands to the child or the supplies that you're using for diaper changing. The diaper changing table should be smooth, non-absorbent, and easily cleanable, and it should be located away from play and eating areas. And there must be a safety mechanism in place to keep the child from rolling off the table if the diaper changing surface is off the ground. You should clean and dry the child with disposable wipes, and you shouldn't use powder, ointment, or lotion unless you have the parent's permission. And you should never share powder, ointment, or lotion between children. They should all be used for the individual child and labeled with the child's name. Place soiled clothes in a tied or sealed closed plastic or waterproof bag. And always wash your hands and the child's hands after diaper changing. A hand washing sink is required in the diaper changing area, and this hand washing sink should only be used for diaper changing. You should never get water for children out of this sink or use it for cleaning utensils or for food prep. You must sanitize the diaper changing surface after each use and keep all diaper changing supplies out of kids' reach. Very important to use universal precautions outlined by the CDC when handling bodily fluids, including blood, vomit, or feces. A food establishment, including a child care kitchen, must have written procedures for employees to follow when responding to vomiting or diarrheal events. The procedures must address the specific actions employees must take to minimize the spread of contamination and the exposure of employees, consumers, food, and surfaces to vomit or fecal matter. First step for cleaning up bodily fluid spills is containment. For example, block off access to the spill and move children to another room while cleanup is taking place. Follow the rules for excluding the ill child or staff member. It's just as important to keep the employee cleaning up the spill from getting sick. If you're the employee designated to clean up the spill, use proper protective equipment such as disposable gloves, a disposable apron, and a disposable mask. This is to protect you from contact with disease-causing microorganisms in the waste as much as possible. Do not touch bodily fluids with your bare hands. Remove the vomit, diarrhea, or bodily fluid with paper towels and put it into a disposable trash bag. If any food or food contact items were within 25 feet of the spill, it's possible they may have been contaminated. Dispose of these items or wash, rinse, and sanitize them. Machine wash and dry any clothing or fabric that may have been contaminated. Clean all contaminated surfaces with hot, soapy water. Then rinse and dry the surface with paper towels. Disinfect the surface with the same chlorine sanitizer solution used to disinfect the bathrooms or diaper changing tables. Quaternary ammonia solutions are not effective for cleaning up bodily fluid spills, so if your facility uses a quaternary ammonia solution, do not use it. Instead, create an effective bleach sanitizer solution by adding 1/4 of a cup of bleach to 1 gallon of water. Allow the surface to air dry and throw away all contaminated items, including personal protective equipment. And at the very end, don't forget to wash your hands. Now let's talk about food safety. Have a food allergy emergency plan for each child with a known food allergy that has been diagnosed by a healthcare professional. The child's healthcare professional and parent must sign and date the plan, and you must keep a copy of the plan in the child's file. You must not serve a child a food identified on the child's food allergy emergency plan. For a list of each child's food allergies that require an emergency plan, you must post the list during all hours of operation where you prepare food and in each room where the child may spend time. This posting must be in a place where employees may easily view the list, and if a parent requests it, you must maintain privacy for the child. For example, you can put the plan on a clipboard hung on the wall and then put a cover sheet over the list. And you must ensure that all caregivers and employees who prepare and serve food are aware of each child's food allergies. Safety inspections of child care kitchens are performed twice annually along with the child care inspection. The focus of the food inspection is to ensure safe food handling for children in care. Food safety is one of the first lines of defense in preventing foodborne illness. Because child care facilities serve young children who are more susceptible to foodborne illness, employees in child care kitchens must make food safety a top priority. Even if you or your facility only serves snacks, safe food handling is still critical to prevent foodborne illness. Food safety inspection will not only consider the rules and the minimum standards, but it's also based on the requirements listed in the City of North Richland Hills Code of Ordinances, the Texas Food Establishment Rules, and the 2017 FDA Model Food Code. One certified food manager is required at each child care kitchen to oversee the food safety measures. All other staff that assist with serving lunches and snacks must have the NRH Child Care Worker Card or a state or nationally accredited food handler class for those responsible for more complex food handling duties. This is an example of an NRH health permit for a food establishment. The food establishment permit must be posted within public view. Points of the food safety inspection are food safety and protection, proper food temperatures, safe food handling, hand washing, facility sanitation, and water supply and plumbing, in addition to required training records. Centers for Disease Control and Prevention estimate that each year in the United States, 48 million people get sick from a foodborne illness, 128,000 people are hospitalized, and up to 3,000 people die as the result of a foodborne illness. Every day, millions of children eat food prepared and served in child care facilities. Food must be safely handled to reduce these children's risk for foodborne illness. Foodborne illness is caused by eating food or drink containing harmful microorganisms such as bacteria or their toxins, viruses, or parasites. Viruses and parasites do not need special foods to cause illness. These microorganisms simply use the food as a vehicle to get from one person to another. To prevent these microorganisms from contaminating food, keep your hands and surfaces clean. Children younger than 5 years old are especially susceptible because their immune systems are not fully developed like that of older people. Common symptoms of foodborne illness usually begin 6 to 24 hours after ingestion of the food, but can occur up to 1 week later after contaminated food or drink is eaten. Sometimes foodborne illness is confused with what some people call stomach or intestinal flu because the symptoms are similar: nausea, diarrhea, vomiting, and/or fever. Healthy adults usually recover quickly from foodborne illness, but members of high-risk populations such as infants, young children, those with chronic illnesses, and elderly folks are more likely to develop serious complications that could lead to death. Centers for Disease Control and Prevention have identified the following risk factors for foodborne illness. They include food from unapproved sources, for example, food prepared outside of a permitted food establishment by untrained persons, inadequate cooking temperatures, improper cold or hot holding temperatures, contaminated equipment, and poor employee hygiene. Health and hygiene is very important to food safety. Remember, don't work when you're sick. Proper and frequent hand washing is the most effective means of preventing foodborne illness. Clothing can be a source of contamination, so always wear clean clothing, uniforms, and aprons, and use a hair restraint when preparing food. Don't eat, drink, smoke, or use your phone while handling food. Keep your drinks in proper containers and away from food contact surfaces. Keep personal items like medicine, coats, phones, and purses away from food or food contact surfaces. Food is food that's edible without any additional preparation. Ready-to-eat foods must be handled differently than raw foods. They include uncooked foods such as sandwiches, already cooked foods such as pizza or hamburgers, fresh fruit and vegetables, snacks such as crackers, cookies, and other items such as sugar, spices, and ice. These foods require proper handling during preparation and service to prevent contamination. One way to protect ready-to-eat foods is to use gloves so that germs do not spread. There are proper ways to use single-use gloves, and the most important thing to remember is that gloves are the same as your hands. You must change your gloves whenever they're contaminated. You must also wash your hands before putting on gloves. Don't forget to change your gloves when changing types of foods, and make sure you change your gloves immediately if they're damaged. Only use single-use gloves when handling food. If you need to use a cutting glove, make sure to cover the cutting glove with a clean single-use glove. Never rinse, wash, or reuse gloves. Artificial fingernails and nail polish can be physical hazards that can contaminate food. Try to keep your fingernails trimmed and filed. If nail polish or artificial nails are worn, the food handler must wear gloves when preparing all foods, not just ready-to-eat foods. While preparing food, do not wear jewelry on your hands and arms. The only exception is a plain ring such as a wedding band. Jewelry can hide food particles and germs that can cause people to become sick. The range of temperatures between 41 degrees Fahrenheit and 135 degrees Fahrenheit is called the temperature danger zone. In the danger zone, bacteria grow quickly, multiply quickly, and can create toxins that can cause foodborne illness, even if you reheat the food. Food should pass through the danger zone as quickly as possible, either by rapid heating or rapid cooling. Temperature abuse occurs when time and temperature control for safety foods remain in the danger zone for too long. This can lead to foodborne illness. Time and temperature control for safety foods such as meat, fish, poultry, milk, cheese, and other dairy items, cut leafy greens, cut tomatoes, cut melons, raw seed sprouts, cooked vegetables, soy and tofu items, and garlic and oil mixtures must be kept cold at 41 degrees Fahrenheit or less, or held hot at 135 degrees Fahrenheit or higher to prevent foodborne illness. Hot and cold food temperatures immediately after cooking or reheating and before serving food. Keep a temperature log and record proper cooking and hot or cold holding temperatures. Clean and sanitize the stem of the thermometer before and after each use to prevent cross-contamination. The thermometer's range should be from 0 degrees Fahrenheit to 220 degrees Fahrenheit. Anyone working with food needs to know how to calibrate and properly use a food thermometer. Calibrate food thermometers daily when they're dropped and after they're exposed to extreme temperatures. The easiest way to calibrate a thermometer is with the ice point method. Place the thermometer in ice water and it should read 32 degrees Fahrenheit. If your thermometer is more than 2 degrees off, you know that it's time to adjust it to the proper temperature or to replace it. Ask your certified food manager for help calibrating your thermometer. Infants are very susceptible to foodborne illness. Take these precautions when handling baby food. After opening, label the container with the name, date, and time opened. Never feed directly out of the baby food jar. Bacteria and saliva could contaminate the food and make it unsafe for later use. Transfer baby food from the jar to a separate plate using a clean utensil to avoid contamination. Refrigerate unserved portions of food in the original jar and throw away unused portions within 36 hours after opening, preferably within 24 hours. Observe the use-by dates on unopened jars of baby food. If in doubt, throw it out. Very important to be careful when handling infant formula and breast milk to avoid foodborne illness for the children you're serving. Always follow the manufacturer's instructions for preparing infant formulas. Always use a clean and sterilized bottle. Promptly refrigerate prepared formula and use it within 1 day, and never add new formula to old. Throw out leftover formula in the bottle after feeding. For children that are still breastfeeding, have parents label each container with the child's name and the date pumped. Keep the milk refrigerated and use it within 1 day. Children take on field trips must be stored safely. Foods that must be stored cold must be in the refrigerator or in ice packs until the child consumes the items. Cold food should be held at 41 degrees Fahrenheit or less to limit bacterial growth, and hot food should be held at 135 degrees Fahrenheit or more to limit bacterial growth. You should also be aware of food allergens. For example, while peanut butter does not require temperature control to protect food safety, peanut butter will still pose a risk to children allergic to peanuts. In many cases, children with allergies do not need to eat the food allergen to experience an allergic reaction. Take food allergies of the children participating in the trip in mind when choosing foods. If you have questions about controlling food safety during field trips, consult your health inspector. It's the provider's responsibility to ensure safe food is served to the children. Serving food from an approved source is one way to determine that food is safe to consume. Manufactured foods can be reheated to 135 degrees Fahrenheit for 15 seconds within 2 hours or less before being served. All other time and temperature control for safety foods must be reheated to 165 degrees Fahrenheit for 15 seconds within 2 hours or less. Once the food temperatures are recorded, food should be served immediately or stored in an insulated hot holding case or refrigerator. Before and after preparing food, always clean and sanitize countertops, sinks, high chair trays, tables used for eating, placemats, and bibs. Don't forget that the sanitizer solutions must be at the proper strength to disinfect food contact surfaces, and always use test strips to verify the strength of sanitizing solution. When handling utensils or during service, avoid touching food contact surfaces with bare hands and protect the food contact surface from contamination. Always use a scoop with a handle to dispense ice or other ready-to-eat foods. Never use your bare hands or a scoop without a handle. Store food and paper goods in a clean, dry location in the kitchen. Food contact items, and paper goods must be stored at least 6 inches off the floor. Food should be stored in covered, food-grade containers. Protect food from contamination when transporting it from the kitchen to the classrooms. Make sure that time and temperature controlled for safety food is kept out of the temperature danger zone as much as possible. Prepare foods in small batches to make thawing and cooling easier to manage. Use foods that will expire first before those that will expire later. This is called first in, first out. If storing time and temperature controlled for safety food for more than 24 hours, date mark those foods before storing them in the refrigerator. Destroy all TCS foods by the 7th day. Day 1 equals the day the food was prepared or the package was opened. Check TCS foods with a calibrated thermometer and keep those foods out of the danger zone as much as possible. For example, use an ice bath to transport containers of milk to classrooms to keep the temperature of the milk below 41 degrees Fahrenheit. Foodborne illness can be prevented with close attention to proper food safety. Keeping hands and surfaces clean, maintaining strict temperature control for TCS foods, and preventing cross-contamination are critical measures to prevent foodborne illness. Cross-contamination is a major cause of foodborne illness. Cross-contamination is the transfer of disease-causing microorganisms, such as bacteria and viruses, from one food to another. Washing hands frequently and keeping raw foods away from ready-to-eat foods help prevent cross-contamination. Any hazardous substance, chemicals, and medicine must be stored out of reach of children or be locked in an inaccessible cabinet. Installing child safety locks on a storage cabinet is acceptable. Make sure all chemicals are stored away from food and food contact surfaces and label all chemicals properly. Dented cans are not safe and should not be used. This is an example of an unacceptable damaged can. Cans with dents on seals and/or seams are not safe and should never be used. Store it in the damaged can area until it can be picked up by the vendor or throw it away. Cooler and freezer temperatures should be checked daily to make sure that coolers are holding food at 41 degrees Fahrenheit or below and that freezers are keeping food hard frozen. Inspect deliveries for signs of damage or pests before bringing them into the building, and look for the presence of pests around facilities regularly. Seal any holes, cracks, or gaps in walls, floors, and ceilings. Facilities must be cleaned daily. Remove unused items from the facility that can serve as hiding places for pests. Again, properly store and label all chemicals on site. Keep all chemicals out of the reach of children at all times, and always follow the label directions for any chemicals you use. Now let's talk about the elimination and control of insects and rodents around your childcare. Check the building regularly for holes and cracks in walls, floors, and ceilings, which can pose a safety hazard or provide an entry or hiding point for pests. Be especially aware of air gaps to outer openings. For example, spaces around doors where the weather stripping is damaged, as an entry point for pests. Look for and repair all plumbing leaks and replace burned out light bulbs. Don't forget to remove damaged toys, utensils, and equipment as soon as they're detected. To the left is an example of a hole in the wall underneath the 3-compartment sink. This is a perfect entry point for pests into the facilities. Make sure you seal these gaps. Holes and gaps in floors, walls, and ceilings aren't sealed. Pests will find a way into the facility and cause problems. Like rodents, cockroaches, and flies, must be kept out of child care facilities because they spread diseases. Pests tend to avoid people and hide in hard-to-see or hard-to-reach areas, so keep an eye out for pests in and around your facility. Be sure to check utility and storage closets, baseboards, air vents, and underneath equipment. Pets bite or sting. These pests are a general nuisance and can cause life-threatening allergic reactions for some people. It's important to address insect infestations on site, including ants and other stinging insects. Look for and eliminate standing water on the property or in toys and equipment that may also provide a breeding ground for mosquitoes. Tend to be nocturnal animals and will hide from people. However, you can still detect the presence of rodents by looking for telltale signs such as droppings, which are seen in this picture, or the presence of chewed food containers. Treat your center for pests only if you are certified as a non-commercial applicator by the Texas Department of Agriculture. Otherwise, you must use a licensed pest control operator licensed by the Department of Agriculture to prevent, control, or eliminate pest infestations at your child care center, including the use of over-the-counter products designed for controlling insects, rodents, and other pests. Let's talk about keeping children safe outside. According to the Centers for Disease Control and Prevention, each year more than 200,000 children in the U.S. are treated in emergency rooms for playground-related injuries. As a matter of fact, about 75% of all non-fatal playground-related injuries occur on public playgrounds, mostly at schools and daycare centers. In 1995, playground-related injuries cost an estimated $1.2 billion. Surprisingly, girls are more prone to playground-related injuries than boys, 55% to 45% respectively. The most at-risk age group for playground-related injuries are children ages 5 to 9 years old. Equipment designed for younger children should be clearly separated from equipment meant for older children. Swings are responsible for most injuries on home playgrounds, while climbing apparatus is the most dangerous equipment on public playgrounds. Disturbing surfaces can help disperse the momentum of a falling body or head, thus reducing the risk of life-threatening injuries. Loose-fill surfacing materials include, but are not limited to, loose particles such as sand, pea gravel, shredded wood products, and shredded rubber. Loose-fill surfacing materials require special maintenance. Playgrounds should be checked frequently to ensure surfacing has not displaced significantly, especially those areas most subject to displacement, such as around swings and slide exits. Rake loose fill material back into place as needed. The use zone is the surface area under and around a piece of equipment onto which a child falling from or exiting from the equipment would be expected to land. Other than the equipment itself, the use zone must be free of obstacles that a child could run into or fall on top of and be injured. It's highly recommended to mark the appropriate depth height on equipment support posts so that you can easily identify whether the depth of protective surfacing is still adequate or not. If you use unitary surfacing materials, you must have test data from the manufacturer showing the impact rating of the material, the maximum height of equipment that may be installed over the surfacing material, and you must follow the installation and maintenance requirements. This documentation must be available at the operation and made available for review by parents and licensing staff upon request during your hours of operation. Insufficient or improper surfacing can have harmful or even fatal implications. In 1997, a 10-year-old boy from Kansas died after falling less than 7 feet onto a sand surface from a set of parallel bars. Tragedy such as this has occurred in our community as well. In 2001, a 12-year-old girl died in Fort Worth after she fell 11 feet to the ground surface from monkey bars on a public playground. Pictures show examples of equipment and premises that have not been maintained and pose safety hazards to the children on site. The fence in the middle picture has several loose slats that can fall on or entrap children. The fence that separates the playground from nearby traffic should be in good condition, with no unintended openings. Unless exempt, a fence in good repair is required to be at least 4 feet high. In Baytown in 2018, a toddler crawled out of a daycare's broken fence and onto a busy road. A passersby had to stop traffic to save the child and return him to care. In San Antonio in 2019, 3 toddlers crawled under a fence and escaped another daycare next to a busy road and were saved by a couple driving by. And in Houston in 2022, 3 young children left a daycare facility through a gap in a fence that enclosed the center. That's the top right photo. The person who took the picture stated that the kids were rescued after a bystander screamed for at least a minute for staff's attention. Play areas must be free from hazards and animal waste. Check the outdoor play area daily before children go out to play. Toys and play equipment must be free from rough edges and sharp corners and be of substantial construction. These pictures show some examples of unacceptable broken equipment that needs to be removed or replaced. To help the play facility maintain compliance with surfacing guidelines, daily playground checks are required, and a daily maintenance log is recommended to ensure that loose protective surfacing material is kept at an adequate level. Even though daily checks are required, a monthly playground check is required and is required to be recorded by law. The pictures on this slide show that the support post of playground equipment should be marked to indicate the necessary fill level. This makes it easy to eyeball the amount of loose fill present. Natural playgrounds must be maintained as well. Indoor and outdoor active play equipment used both at and away from the child care center must be safe for the children. Indoor and outdoor active play equipment must be arranged so that caregivers can adequately supervise children at all times. Play equipment must be used according to the manufacturer's instructions. It must not have any openings or angles that can entrap a child's body or body part. It should not have any protrusions or openings that can entangle something around a child's neck or their clothing. It should be securely anchored to prevent collapsing, tipping, sliding, moving, or overturning, and it should not have any exposed pinch, crush, or shear points. Climbing equipment, swings, or inflatables must not be installed over asphalt or concrete unless the asphalt or concrete is covered with properly installed unitary surfacing materials. Porches or platforms more than 20 inches in height for pre-kindergarten and younger children and more than 30 inches in height for school-age children must be equipped with protective barriers that surround the elevated surface, except for entrances and exits, and that prevent children from crawling over or through the barrier. Steps on climbing equipment, regardless of height, must have handrails the children can reach. Roots and loose or warped floorboards sticking up from the walkway can create trip hazards that can result in injuries on the playground. Surfaces should be free from items and debris such as toys, tree roots, and rocks, which may cause a child to trip and fall. Standing water can also cause dangerous slips. Playgrounds should be maintained to remove dangerous debris, such as broken glass, sharp sticks, and twisted metal, which may injure a child if he falls on them. An example of a playground daily building and ground safety checklist. Also to your left is an example of a playground safety maintenance checklist. This document, a monthly checklist, and other resources are available at the Texas Health and Human Services website. Equipment and maintenance inspections advice will reduce the incidence of playground-related injuries. Child care centers that have a swimming pool must meet state code and all NRH codes of ordinances. It's the provider's responsibility to ensure that the water quality is balanced daily and that all these rules are met. Improperly maintained water quality in swimming pools can lead to the spread of disease. It's important to maintain the proper chlorine levels because chlorine kills many disease-causing germs. Other diseases, such as Giardia, are not killed by chlorine. These germs are filtered out by the filtration system. Lifeguards are required when children in care are swimming. A certified pool operator is required on site when you have a swimming pool on site, and all health and safety requirements such as an emergency phone, ring buoy, and shepherd's crook are required in order to operate. Consumer Health inspects NRH pools at least monthly during pool season. An effective fence is one that prevents a child from getting over, under, or through it, and keeps the child from gaining access to the pool or body of water except when supervising adults are present. Fences are not childproof, but they provide a layer of protection for a child who strays from supervision. You must enclose a swimming pool at your child care center with a 6-foot-high fence or wall that prevents children's access to the pool. That is the end of the child care worker training. Stay tuned for some practice questions that will help you prepare for getting your child care worker card. Following questions will assist you in preparing for the test that you must take at Neighborhood Services on the first floor of NRH City Hall, 4301 City Point Drive, North Richland Hills, Texas, 76180. Question 1. What is the best way to prevent the spread of germs? The answer is C. Properly washing your hands. Wearing gloves and wiping down the counters is useful, but nothing replaces good hand washing. Question 2. When should a child care provider wash their hands? The answer to this question is D. All of the above. You should wash your hands before handling food, after changing diapers, and after outdoor activities. Question 3. What's the temperature danger zone for food? Remember that the temperature danger zone is the temperature range in which bacteria and other microorganisms grow rapidly, multiply rapidly, and create toxins that can make people sick. The temperature danger zone for food is 41 degrees Fahrenheit to 135 degrees Fahrenheit, or option C. Another question. When should a child care worker or food handler label food or chemicals? The answer is A, when it's taken from its original container. Then foodborne illness goes unreported because symptoms. The answer is D. They can be similar to having the cold or a flu, and they may not appear until days after you've eaten or drunk the thing that made you sick. When using any chemical, you should always use caution. You should never mix different chemicals together. You should always follow what the label says. Is required to sanitize? The answer is option C, both A and B. You must always use an EPA-registered chemical to sanitize and follow label instructions. There is also a 5-step process for cleaning and sanitizing. Washing the item with soap and water, then rinsing the item with clean water, spraying or soaking the item in an EPA-registered disinfectant for at least 2 minutes, then rinsing if the item is likely to be placed in a child's mouth, and finally air drying. Members that provide snacks to children should do what first? The answer is C. They should always wash their hands properly and then apply clean gloves. How hot should you reheat time and temperature controlled for safety foods? The answer is A. 165 degrees Fahrenheit is the safest reheating temperature, and you should heat the food for at least 15 seconds within 2 hours. Children are more susceptible to harmful bacteria because D. Their immune systems are not fully developed. Which of the following is not an approved playground surfacing material for use zones? The answer is D, concrete. If a child is displaying symptoms of illness, child care workers should, the answer is B, watch for signs and symptoms of illness and then take appropriate steps, such as notifying your director or assistant director, taking the child's temperature, calling the child's parents, and separating and supervising the child separate from other children. How often should you follow the label instructions for your sanitizer? The answer is C, every time you use it. Should the active play and playground be inspected? This is a trick question. The answer is both B and C. You should always be making daily checks of your active play and playground areas and your building and center as a whole, but you have to record monthly inspections of the active play and playground areas. What cracked or broken equipment should? The answer is A, be discarded. And that is the last preparatory question for the child care worker exam. We hope to see you soon at Neighborhood Services on the first floor of NRH City Hall, 4301 City Point Drive, 76180. Thank you for taking the NRH Child Care Worker class.